Dr. Hall, you guys can have a seat right here.
All right, so what seems to be your problem?
We have been trying for a year to have, we want to get pregnant. So we've been trying unprotected sex and trying everything we're supposed to, and no results. The last results I had last week, negative, and I've been keeping my hips up and doing everything I'm supposed to be doing, the doctor told me, and nothing. And I mean, no offense, but he is a beast when he has. So
we've been keeping track of the monthly cycle. We bought a basal thermometer and took her temperature every morning before she got out of bed and wrote it on a chart. We've been keeping track of the quantity and the texture of her cervical mucus, which gets more slippery as ovulation occurs. Have you taken your evening primrose oil, honey?
I've been taking it, yeah.
You know that can help to improve the consistency of your cervical mucus.
Mm-hmm.
How about the chastity berry tree berry? It can help lengthen your luteal phase.
No.
Red raspberry leaf tea is also a good thing to drink to improve fertility. We've tried all of these.
It's expensive. It just seems like I'm running out of options.
Yeah, I've even stopped going to the hot tub and sauna so that I can decrease my scrotal temperature.
Yeah, I know the temperature of the scrotal that needs to be cold. So we've been cutting that out at home.
And we've even tried the at-home insemination syringe, and that didn't work either.
No. And then that's when I cut my hips up. After sex, I keep my hips up, and nothing.
You know, there can be several causes of infertility. It could be congenital, or it could just be that the timing is not quite right. 1/3 of infertility does involve males, and another third involves females. Some causes of infertility in males is abnormal sperm production or function due to various problems. Do you have a history of any health problems?
No, not that I know
of. Okay. Have you been screened for any ovulation disorders or?
No screening. I mean, HPV, do you think that's something that could have caused it?
It can affect fertility, as can cervical and uterine abnormalities. Have you had an ultrasound to determine if you have any abnormalities in that area?
I have, and I have no abnormalities. I had a positive test for HPV, and that was it. And then when I went back to my next pap smear, it was negative.
All right. So would you guys like to talk treatments and options that may be available?
Yeah, we'd like to know all of
Yeah, because I mean, she's wearing me out. I need to figure this out.
I'm ready to have a baby.
Well, there's fertility drugs. They come in an injection form or a pill form. And these have been proven to have a 40 to 50% success rate. There's artificial insemination, which you guys have tried with that syringe, but we have different methods other than just the syringe. Usually the success rate depends on the woman's age and the quality of the sperm, but it's about 60 to 70% successful in pregnancy after 6 cycles. And that runs about $865 per try.
What if insurance
My
covers
sperm
that?
is pretty high quality.
Well, I can take you after we're done with this to do some tests.
Oh, I like the sound of that.
Okay, in vitro fertilization.
Unfortunately, everybody, I'm sorry for my husband.
It's alright, you get plenty of patients like him. In vitro fertilization is a multi-step process in which your eggs are extracted and fertilized with sperm in a lab. Success varies by age, and it decreases the older that you are. Average cost is about $8,000 per cycle, and that's not including the medications. Donor sperm involves sperm collected from a male and used during the in vitro fertilization.
Now wait a minute, which male is the sperm going to be collected from?
It depends on the results we get from the testing that we're going to be doing later. So if the test concludes that yours is no good, then we'll have you guys select a donor.
Well,
We
boy,
understand.
honey, I don't know about that.
We understand some couples are insecure with that because there is no genetic relation, but we do have a pretty high success rate with that.
So that's like, I don't have to sleep with the guy, right?
Right.
No.
Okay.
It carries about an 80% success rate, and that costs between $300 and $400. And then there's intracytoplasmic sperm injection. It's where an embryologist selects a healthy-looking single sperm from the male semen and injects it directly into the egg with a microscopic needle. So that could be an option for you guys. It carries about a 35% success rate when undergoing ICIS with in vitro. Average cost ranges from $1,000 to $2,000 per cycle, excluding the cost of the in vitro. So it'll run about $10,000 for that. Donor eggs, if it turns out that the problem is on your side. The resulting embryos, well, the eggs obtained from the ovaries of another woman and fertilized by the sperm from your partner. The resulting embryos are transferred into your
No,
uterus.
you don't get to cheat. It's the same scenario.
Thank you for clarifying that with my husband.
Success rates are about 55% if fresh eggs are used and 34% if they're frozen. Cost is between $15,000 and $30,000, which includes the in vitro and the donor compensation. And then there's surrogacy, where another woman would carry your fetus if you have abnormalities with your uterus or cervix. That costs between $50,000 and $100,000, depending on fees, compensation, and whether IVF is used. And then there's reproductive surgery performed and requires a hospital stay, but can be done in some offices as an outpatient procedure. We don't do that here.
No.
It's used to correct anatomical abnormalities, remove any scarring and blockages. The success rate depends largely on the condition and its severity and on your age. Besides reducing pain or discomfort associated with the disease, it may increase the likelihood of you getting pregnant. Cost for the surgery is usually between $1,700 and $5,000. And then there's gamete intrafallopian transfer, which is where your eggs are collected, mixed with the sperm in a petri dish, and then placed directly into your fallopian tubes.
Is that painful? Will that hurt for that procedure?
It'd be the same as IVF.
Isn't that how we can have a bunch of kids like Octomom?
Yeah.
Is that how that happens? Because we're sort of looking for a contract with
The success rate for this is about 25%, up to 30%, and it allows fertilization to occur in a natural environment, so it wouldn't be a test tube baby.
Oh, okay.
For those of you that have more objections.
Yeah. I don't want kids around school being like, test tube baby, you know.
Well, you don't have to tell teachers or anything.
You know, I have a big mouth. My friends are saying that.
The cost of that is usually between $15,000 and $20,000. And then there's zygote transfer. It's like IVF, but the embryo is inserted into the fallopian tubes, not the uterus. This is best for couples who have unexplained infertility problems. And it's best for the woman if they have at least one tube open or if they have ovulation problems. Success rate is about 29%. Fertilization with the egg and sperm mixture, now called the zygote, can be confirmed before it's placed. So then all it would have to do is implant the uterus. Okay, cost for this is between $8,000 and $13,000 for one cycle.
Oh, wow.
So most of these interventions can be pricey.
Okay. Well, what do you guys suggest?
I think we should do the testing. I can take you to do the testing that I mentioned.
Okay.
We're gonna need a sperm sample. We have a room to the side that has a bunch of material you can use. And for you, we're going to need a couple egg samples and probably run some blood tests.
Okay.
If you guys are ready and serious, I can take you to start that now.
Let's do it.
You wanna do it?
Yeah.
Okay, I'm gonna
Okay.
take them to that.
Thank you, Dr. Hall. It's very
Follow
nice
me
to
this
meet you.
way.
Hopefully we'll have results.
Thank you.